Hello everyone, this is Dr. Karen Sullivan back with you for another I Care for Your Brain lecture. I wanted to do this one again because I tried to do it last week. I thought we were having technical difficulties, but it was Facebook. So the picture is all funny and grainy, and I think I was having some bad connection back and forth. And this lecture is really so important, and it cuts across so many of you who listen to us that I really felt like I wanted to do it again. So if you've seen it already before, maybe hearing it a second time will reinforce the learning, but also maybe you didn't get a chance to watch it or you tried and it was just too frustrating. But we are back and we are going to talk tonight about the importance of having your map when you have any kind of a brain injury. When we think of brain injury, so often we think of TBI, we think of traumatic brain injury, and we think of a mechanical force that hit the brain and caused it to move around in the skull. But the way I think of brain injury, the way a lot of neuropsychologists think about it, is that it's anything that goes wrong in the brain, from Parkinson's disease to essential tremor, really to many cases of mental health issues, depression, post-traumatic stress disorder, Alzheimer's, Lewy body dementia. So many of the different things that brought you guys to this page, you could still consider that to be a brain injury, right? And we have to talk about how important it is to know exactly where you are in this moment in your never-ending recovery and where exactly it is that you are going in the future. And one tool that I use to figure this out in my practice is called the map. So I wanted to talk with you all about that tonight. So before we get started with that, though, I do want to tell you about the March Madness giveaway that we're starting, and I want to be totally transparent. The reason that we're doing it is to get more followers. You guys who are on here are so awesome, and I love talking with you every week, and I want to do more with this page, but the only way I can really do it is to get more numbers, more likes, more followers, so that way I have some power to maybe get some sponsors to do some stuff that I need to do that I can't take away my time from my practice to do without the support of somebody helping me get this message out there. So I want to start to do that in the new year, but really I need the numbers in order to be powerful enough to convince people that maybe they should have an ad on here with me to do these lectures. So what we're going to do from today, March 20th, until March 31st is enter you in a contest every single time you share a post from this I Care for Your Brain page. If you share the one that is directly below me during this talk, which is kind of just a general go like this page, you will get 2 entries for the day. And I wanted to start off this lecture tonight by announcing our very first winner. We are going to give Neuro Transformers, who is a wonderful woman who has started her own Facebook page to support science-based brain health. It seems to me based on her own journey and using that experience to uplift and empower other people. She's been a great supporter of I Care for Your Brain and has shared a lot of our stuff, and I wanted to tell her tonight she is the very first winner. So every day a winner is going to get access to my 9-part lecture series that we have online. I went into a movie studio last summer and recorded all of these, I think, pretty helpful, informative lectures, and Neurotransformers will get access to them starting today. So she can send us a message here or we will try to reach out to her. Okay, so let's get back to our topic tonight. So what the heck is a map? Well, you all know what it is in terms of geography, right? So the way I want you to think about it with brain injury is that it's a guide. It's a collaborative, living, breathing document that is critical to your recovery, not just of your brain, but of your mind, of your body, of your spirit. We never want to forget that recovery from brain injury has to include all 3 of these. This is not just a physical problem. This is not just a medical problem. It's not a physiological problem. The brain is the organ of the self, and so whenever there is a problem there, we are going to have adjustment issues. We are going to have emotional symptoms, and that is not because we are not handling it well. That is because we are human, and it's hard to go from one level of functioning to another. It's hard to have a traumatic, unexpected, life-threatening thing happen to you like a stroke. You're not just going to come out on the other side with physical injuries, okay? It is going to be a recovery that has to involve your very self. So when you think of your recovery, I'm sure that all of you want an optimal recovery, right? You want to get back as much function as you can. You want to the degree possible, regain all abilities or adjust to them, meaning that you accept them, you know how to compensate for them, right? What we all want to do is get back to the highest quality of life possible. And this is a huge goal. This is complex. And this is why you need the map, because you need to know how to get from point A, where you're at now, to point B, which is your optimal recovery. So when you think of a map, it's something that shows you information, right? That you cannot get from your vantage point, right? You cannot see the forest for the trees. This is how you know where the roads intersect, what road you're on now, you know your destination, and you know a very specific path on how to get there. They can show you the hazards. They can show you where not to go. They can show you what roads have been washed away and no longer exist, okay? They give us clear options when we feel lost. It's something that we can consult to make sure that we are on the right road. And the road that we want to be on is that optimal recovery road, right? So let's get out of the realm of metaphors and really get into specifics. Okay, so what do I mean? So your map is a guide that there are 2 points on, okay? Your first point is where you are now, and your second point is where you are going in the future. So let's start with point number 1, where you are now. This is the specifics of your injury. Being an information gatherer, knowing exactly what your risks were that brought you to your brain injury. So for stroke, we want to know what was the most specific understanding possible that led you to your specific injury, your specific stroke, okay? Where exactly in the brain that it happened, learning as much as you can about this part of the brain. This is one of the reasons that I'm with you, because too often people do not get enough basic information about their brain injury, no matter what it is, okay? And people are left wondering, is this symptom part of my brain injury? Is this something to do with another medical condition? Is this to do with me, that I'm not coping well? And so often it is an actual brain injury, but it's not something that is readily seeable by other people. It's not something that can be quantified. It's not arm strength, right? It's something maybe that's happening in your mind, something that's happening in your person. So we need to help figure out how to find this point on the map. And how do you figure out exactly where you are now? You find care providers that care and that can collaborate. And I know that sometimes this is easier said than done, depending on where you are in the world, what your insurance is, your access to transportation. So I realize I am talking in kind of an idealistic way, but I do want to let you know in a perfect world how this would look. So the first thing is understanding exactly what problem your brain is having, okay? And then you need to get really clear on all the different domains that are affected in your specific unique brain injury, okay? So when we think of the brain getting injured, we can have problems in our senses. So this is our eyes and our ears. We can have, of course, problems with our physical person, weakness, paralysis, pain. We can have cognitive issues with processing speed, attention, memory, word finding. We can have emotional issues. We cannot be able to control our behavior. We can be impulsive. We can be very underactivated, where we don't want to do anything anymore. And we can have social issues. We can be isolated because of trouble with driving. We cannot be able to work anymore, so we can't be around people in the same way that we used to. There's all these different ways that a brain injury can impact your life. So your job, and I'm going to tell you how to do this by the end of our talk, is how to start documenting what your specific impairments are in all of those domains, okay? And you have to go out and seek assessment from clinical experts in those domains to get a good understanding of exactly what the problem is. So many people with a brain injury have very broad complaints that if they were to see the right type of professional, they would be able to narrow down exactly why the problem is happening. And I'm going to use the example of neuro fatigue in a few minutes to explain this a little bit better. The second point on your map is your destination. That's where you're going. That is what your treatment goals are that are realistic. Now, this does get a little hard because who can really tell you what a realistic treatment goal is? Nobody has a crystal ball. Every brain injury is different because every brain is different to start out with. Recovery can happen in leaps and bounds. It can happen in teeny tiny little baby steps, but there are some general guidelines that we can help you with as professionals to say, I think it's more likely than not that this will be the level of recovery that is realistic for you. And what we can do is put you on the path to figuring out what are the specific steps based on how clear we are about your certain problem to get you to the highest level of recovery possible. Okay, so we're going to just use one example before we get to the neurofatigue and thinking about a visual impairment after an occipital lobe stroke. Okay, so that's the back part of the brain, and that is where we really integrate and process all of the visual information that gives us one clear image that we see with our eyes in our mind's eye. So sometimes after these strokes, people don't exactly know what the injury is. They just know something's off. They're bumping into things, feel off kilter. They could go to an ophthalmologist who has expertise in the eyes, and maybe their acuity, meaning their clearness of vision, is perfect. And really the problem is that they are having difficulties with a visual field, actually seeing in the right lower quadrant of their vision, okay? So if they go to see a neuro-ophthalmologist, so this is a specialist who really understands the visual impairments that can happen at the level of the brain, maybe then they are able to tell you, okay, so you have a lower right quadrant visual field cut, meaning it's really kind of dark and your brain is actually trying to do its best to fill it in, but because it can't actually process that area of space, you are having problems with getting around in small, tight areas. You're having problems with parking your car, right? So now you actually have a very specific problem to treat. And now that person can get you, hopefully, to experts who understand how to treat a lower right-handed quadrant visual loss. And it goes from being this vague complaint of, I don't know, there's just something off about my vision, to now we know exactly what it is we're treating, okay? And now we can go to visual rehab. We can go see occupational therapists that specialize in vision. We can get mirrors for the car. We can teach you how to actively compensate because we actually know what the problem is. So that first point is so important. It's getting clear on exactly what the problems are. The second point is the expert telling you, okay, these are the steps that you need to take in order to try to rebuild this specific function of the brain. Okay, so if that makes sense, let me know so I know that it's all coming out coherently. So one of my questions is, do you have a map, and who is responsible for getting yourself a map? Well, I think the truth is that it's you. You are the one that has to be the leader of your recovery team. Sometimes we can't be our best cheerleader because we're exhausted, or we have issues related to our stroke, or maybe we also have some depression and hopelessness that's going on, and hopefully you have a friend or a spouse or a medical team that can help you. But the truth is, to the degree that you can contribute to developing your map, that really is your responsibility. So I want to give you some steps tonight to figure out how exactly you can do that. So the first thing you can do is get a piece of paper and a pen and just start making some columns, okay? And I want you to label the columns with all the different domains that could possibly be impaired after a brain injury. So remember, we're going to do sensory, which is your eyes and your ears. We're going to do physical. We're going to do cognitive. We're going to do mood. We're going to do behavior, emotions, and social, okay? And within each of these columns, I want you to write as clear of a description of the problem as you possibly can, okay? What words can you give your problems that would best describe exactly what it is that's not going as well as it was before your brain injury, okay? You should bring this to your next doctor's appointment, your neurologist, your rehab doc, even your primary care physician, and ask them to read it, and ask them, who should I see next that can help me with this specific problem? Who in our community is somebody that deals with behavior issues after a TBI? You know, people keep telling me I'm irritable, I'm grumpy, I'm yelling at them. Who are the professionals in our area that specifically help people with that, okay? Then you're gonna advocate for a referral to that person. You're going to go to that person with your list and you're going to say, these are my issues. Please evaluate me and tell me what exactly do you think is going on. I need a plan for how to either actively compensate for it and try to get some return of function, or I need you to help me accept what's going on and learn to live with it and work around it. Too many times in brain recovery, we get stuck on this idea of optimal functioning, to go back to exactly the way we were before. And I don't think that that's fair. I am an optimistic realist. Of course, I want people to do their very best after any kind of a brain injury. But the truth is that many brain injuries leave people with permanent deficits. And we have to also talk about acceptance and learning how to work within different new restrictions, but still have a very high quality of life, still be able to live our true destiny as individuals, right? But that's going to take working with people to pinpoint exactly where the problem is and instruction on how to get around that specific problem, okay? So going to your providers, figuring out, okay, who is the most qualified person in my area, or even going on free resources like YouTube. I mean, you can look through, I think I've done almost 100 videos now in the last year and a half. Maybe I've done something on your specific stroke or your specific issues of coping. Information, information, information. That is my best advice on how you can empower yourself to figure out where your map is. How does a neuropsychologist fit into all this? Well, I think one of the things we're best at is bringing bits and pieces together to arrive at a coherent whole understanding of a person and their injury. So if you have not seen a neuropsychologist, I highly recommend that you try to get to one. We are very good, I think, at being comprehensive, personalizing your brain health care, and giving you practical advice and steps on how to get better. So let's take the example of neuro fatigue, like I was saying before. So many people after all types of brain injury are very, very tired. And this happens for two reasons. One, the brain is used to being very, very interconnected. And the whole brain really works by communication across many complex networks or channels, right? So if one area is having a problem, it's simply going to take more time and more effort for the brain to work around that problem. So think again of a map and think of like a big old pothole or a part of the city that's kind of, cordoned off. It just takes more time to drive your car around the pothole. Okay, so that's part of it, is things are just harder now that your brain is not so well connected, and that takes more mental energy and you get tired. The other thing is that our immune system in our brain wants to clean things out. It doesn't like intruders. It wants to know exactly what is happening in that brain is what is supposed to happen. And so if there's something going on there, like some brain cells have been damaged and they've released their contents and they are mucking up the works and making it hard to have this chemical and electrical communication that we need to have in the brain to have everything be working well, it wants to get in there and munch away all these different things and be able to process them and excrete them and get them out. That takes a lot of focus, and so your immune system makes you tired in order to get in there and munch away all the stuff that shouldn't be there. That goes for Alzheimer's disease with the plaques and tangles. All sorts of different things in the brain make people tired. Okay, so that's a very common symptom. So when people come to see me as a neuropsychologist, we can try to figure out, okay, beyond those two things, is there anything else that is also making the person have to work so hard that their brain is absolutely exhausted at the end of the day? So one of the things that we commonly find is reduced processing speed, and it gets back to that whole idea of the brain not being as interconnected, that people with brain injury are often one step behind what is actually happening in the moment. And the world is very, very fast today. People talk really fast. I know I talk fast, and I'm sorry, but I'm enthusiastic, and I try to slow down, and maybe I should try to do that better, especially with this conversation. But things are happening a lot. You try to watch the news today, and not only are you trying to listen to the newscaster, but you've got words going on the bottom of the screen, and then maybe you also have some things on the top, breaking news, that are trying to get your attention. People with brain injuries cannot focus well on multiple things at once. for a large part of their recovery. Some people never get that skill back. For some people, it's more in the acute recovery stages in the first months or the first year or so. But if we can figure out that reduced processing speed is making you have to focus so hard, there are things that we can do that can speed up processing speed. A lot of people take stimulants, similar to the drugs that we give people who have attention deficit disorder after a stroke, because it literally speeds up the connections in the brain, so people's brain isn't having to work so hard. We can also find that people who have fatigue are often very overwhelmed, that maybe sometimes there is a sensory issue in the eyes, or maybe they're just very sensitive to sounds. I had a patient this morning actually who was telling me he can't go to parties because it's just too much. He used to be able to hear background noise but kind of mute it with his brain. There's something that happens in all brain injuries where it's like you're wide open. The brakes just don't work as good, and it's just a lot coming at you at one time. So we can talk about things like wearing earplugs, slowly desensitizing yourself to not just go from 0 to 60, but slowly figure out over time how to be more and more comfortable with being overwhelmed, right? There's the permanency of brain injury symptoms, and then there is you and how you cope with it, okay? So I never want you to forget that there's always going to be ways to learn how to cope. You may not be able to get a specific function back, but in your map, you should have roads that are labeled coping strategy 1, coping strategy 2, and so on and so on. You should have tools that will help you get from where you're at right now to exactly where it is that you want to be. I think as neuropsychologists, we also do a really good job of helping you prioritize strategies, right? I may figure out in one of my assessments that somebody has poor processing speed, they have withdrawn because they feel overwhelmed, they have developed a depression, they also have a problem with their short-term verbal memory, and this is a lot, right? But I can help people understand, where are you going to get the most bang for your buck, right? What should you go after first that will hopefully reduce the significance of all the layers that are lining up to give you the effect underneath, okay? And we also, I think, are really good at giving you support and motivation for how it is to start developing your map. And then, of course, reassessments about every year are appropriate to reevaluate someone's map and make sure that they're still staying on the best path in order to get to their destination. But my point tonight really is, if you don't have your current location identified and you don't know where you're going, you're going to be lost. You have to have this stuff literally written out, and you have to have a team of people that understand where you're at and where it's realistic for you to go, so you don't ever feel like you're not actively working towards your recovery. People will be recovering forever and forever getting better from all types of brain injury if they can just pay close enough attention to figure out what those small steps are that seem to be slowly getting better, or ways that you're accepting, or ways that you're compensating. So that is my talk about the map. I hope that maybe that inspired some of you to get one, to think about it, to jumpstart your recovery if it's been a while since you have had a good evaluation. It doesn't matter if you had a brain injury 25 years ago. There's still the opportunity to make your map, to know exactly where it is that you're going, and restart your never-ending journey to getting as much of yourself back as you possibly can. So if you thought this was helpful or interesting, please like it and share it with as many people as you can. And don't forget our March Madness special. So the winner for today was Neuro Transformers, and we're really excited to get in touch with her. If you like and share the little JPEG that's underneath my talk tonight, which is just trying to get people to understand what we're doing here on the I Care for Your Brain program, you'll actually get 2 entries. Who doesn't want 2 entries? And what you guys get is access to my 9-part lecture series that I have done as a video educational program. And I talk about what you need to know about the aging brain, the brain's blood supply, how substances affect the aging brain, how to minimize your risk factors for dementia throughout the lifespan. There's things that we can actually do for babies in utero that will reduce their risk of getting dementia in the future. Isn't that amazing? talk about coping, talk about the importance of social connection, evidence-based recommendations for memory, the importance of sleep. It is comprehensive. It took me about 2 years to put together. So everyone who wins from today until March 31st will get free access to that. So right now we have about 4,400 followers, and my goal at the end of this giveaway is 5,000 followers. That is our goal. So please help me by being able to get more people, and I promise you I will then be able to put more time and effort into the information that I share with you for free. Thank you guys so much, and I will see you next time. Bye-bye.